Welcome, friends, and thank you for tuning in to another episode of the Optimal Health Program. Hope you're doing well today. Have a lot of great information to cover with you. Have some great research studies on the Mediterranean diet helping to reduce the risk of cancers. We'll talk about that. We'll talk about people from Calabria in Italy. I was just recently given this interesting study. They have a genetic predisposition to increased risk of migraine and headaches. We'll talk about that. Yogurt may help to protect against colorectal cancer. And we're going to talk about the cellular benefits of exercise, what goes on in your cells, what happens to your body when you do exercise, and we'll look at a variety of different things that occur that people typically take for granted. You know, you go and you do some activity and people think, well, yeah, it's good for my body, but this will give you some specific reason as to why. So let's start, of course, mentioning the phone number here, 888-420-9272, 888-420-9272 if you'd like to call in. Garden City office is 516-794-0404, 516-794-0404, and the website's drcalapai.com, drcalapai.com. So, Mediterranean diet. Let's look at our cool visual. We have a cool picture of some healthy vegetables and delicious foods that are part of the Mediterranean diet. And look at all the wonderful colors, the reds and the greens and the yellows, all the great antioxidants, the beta-carotenes. Mediterranean diet is one of the oldest diets in history. This study, and this comes from Medical Research News, talks about the Mediterranean diet decreasing the risk of obesity-linked cancers, including liver and kidney cancer, and 13 other cancers. So you certainly want to consider putting these types of foods into your diet, getting rid of the bad. The prevalence of being overweight or obese increases the risk of cancer, and since 1975 to 2016, 39% of global population is now considered obese or overweight, but weight changes have occurred a great deal between that time of 75 to 2016. Developing cancer in 13 anatomical sites, we see that kidney, liver, breast, endometrium, esophagus are correlated with overweight or obesity. And we want to decrease abdominal adiposity, which is fat around the abdomen, which is in many cases the hardest place to get rid of the fat. This is a great study, 521,324 individuals between 35 and 70 from 23 centers across 10 countries. This is a great study, a big study, not something localized to one area with a small amount of people in it. 29% were men and 70% were women. And as it goes through the entire study, talking about dietary changes, those that had the Mediterranean diet on board, lots of vegetables, no junk food, of course, good protein sources, olive oil as the major component of the fats. The oils had a significant decrease in the risk of cancers. So important to start changing your diet. We talk about this all the time. And in the 39 years I've been a physician, we've been talking about different types of diets. So by far, the Mediterranean diet has proven to be the best. But there are names given to different diets. There's low carb, and there's Atkins and Zone, et cetera, et cetera. There's diet based on your blood type. So if you talk about the Zone diet, you're decreasing the carbohydrates, but not enough to really show the big impact of lowering triglycerides and burning cholesterol and losing the weight, I think, in a quicker fashion. So there's some people who like Atkins diet, some people that don't. They don't like as much of the fat. They don't like as much of the red meat. That's fine. I don't call what I do a diet name. I call it a diet based upon the person's results. So it's a Joe diet or a Karen diet or a Susan diet. And it's based upon your blood tests. If you need more protein, great. If you don't want to have one type of protein, we can have another. For people that want to be plant-based, certainly can do that. I tell everybody that I use a plant-based protein powder every day, first thing in the morning, and I'll put it in my coffee. So I get 21 grams of protein, vitamins, etc. I'll put collagen peptides in with that. On a side note, I was buying that at a facility, a very famous place that I mentioned before, but it's more expensive at that place. I went to a different place, BJ's. They had the exact same product in a larger container for a great deal less, $20 less. So for those of you who belong to BJ's, Costco, sometimes if you look for these things, you'll find them at a very significant decrease in cost. It's an organic protein powder called Orgain. At any rate, so we shouldn't be forcing ourselves into someone else's idea of a diet. We should be learning about our bodies, see what we need, correct that, and put together the foods, whether you do small meals multiple times a day, or if you want to do some intermittent fasting, making sure you're taking your vitamins to achieve your result. There are a lot of different ways to do it, but I think the best way is to prove that what you're doing is making your body healthier with your vitamins, minerals, and your hormones. A comment on the blood type diet, which doesn't have the same, I think, effect or the same following that it used to. If you're diabetic or if you're allergic to a food, many of the diet books don't take into account for that. And people that are diabetic should keep their carbs as low as humanly possible because they're already having a hard time burning sugars. So you don't want to have a diet that would have too much carbohydrate on board. And different blood types are suggested to have different amounts of proteins, different amount of carbohydrates. If you're a type O, supposedly you're supposed to have more of the carbohydrate, but it's not going to be good if your triglycerides, cholesterol are high, or if you're diabetic. So push aside the diets with the name, make your own diet with your name. That's the most important way to do it. Because, of course, we're perfecting your vitamin and mineral levels by testing you, making the recommendation with foods, making recommendations with nutrients, and also retesting you within a month to prove that your vitamin levels are great, your hormone levels are great, you're doing your exercise. We'll get into the whole exercise scenario in just a minute. But your body requires vitamins. It also requires exercise and activity and movement. It also requires good hormone levels. So give your body what it needs. And your requirement may be different than mine. And someone who's younger may need higher levels of nutrients because they're very active. Marathon runners, ball players, pro athletes need higher levels because they're burning through the nutrients. People that are older who don't absorb as well might need higher levels of nutrients to create better absorption. But again, the blood test will tell us that you're in the perfect zone. I was talking with Frankie when I first walked in here, and we got on the computer. And one of the patients from the other day from Rumble, her name was something real cutie.
Was it Sweet?
Real Sweetie?
Yeah.
She said that her doctor has been telling her for a very long time you don't need vitamins. I categorically disagree with that. As many percent, millions and trillions of percent as I possibly could. There's ample research on the fact that your body needs vitamins. They're food for your cells. If your doctor is telling you you don't need vitamins, that's missing out on a really, really important part of you being healthy. So we went to look at Google Scholar, once again, one of my favorite search engines, to see how many studies there are on vitamin D. And it's 4 million plus. So if vitamin D was not important, would there be 4 million plus studies on vitamin D? And all the research on vitamin D over the last 10, 15, 20 years and more has showed the importance of D helping to strengthen your bone, enhance immune response, be good for just about every part of your body. Brain function, decreases the progression to brain loss of function and correlations with dementia and even Alzheimer's. That's just one vitamin. And then I said, well, let's take a look at vitamin C. Similarly, 4 million studies on vitamin C. And beta-carotene was 400,000 or 500,000. B12 was 1 million. So the studies are there in the millions. I'm not suggesting that you go on Google Scholar and read every study, but you can go on there and just pick the studies you'd like to read and look at the same research that I'm looking at. So the importance of vitamins can't be understated. If someone's telling you, a friend or a family member or a doctor, etc., that you don't need vitamins, they're really, really wrong. I wouldn't follow that recommendation. And again, if you want to take vitamins, you've got a blood test first, get the recommendation together, and retest to prove that your levels are good. As we see in many cases, and probably every patient I've ever seen over 39 years, people are taking some sort of vitamin, but they don't know what to take. That's why the blood test is so important. And invariably they come in and say, well, I was taking this amount of that. I thought that was a lot, but no, your body needs more of that. So that's how we put this all together in the perfect fashion. Phone lines are open if you'd like to contact us. 888-420-9272.
We already...
888-420-9272. We have some questions.
We have some TikToker asking. He said, I've heard that vitamin D deficiency is really common. I don't get much sun. Should I be taking a supplement, and how do I know if
I think everybody needs supplementation for vitamin D, because even people that I see that live in Florida or go to Florida for the winter or that are tan, their vitamin D levels are never where they should be. I think they should be between 80 to 100. That's where science shows you get all the benefits. So if you're 30 or 40 on your blood test, and the expected range is 30 to 100, by the way, you're not near where you need to be. So I think that you need to take vitamin D every day. And it depends upon the individual, depends upon their activity, but I would give the vitamin D supplementation every day until we have the correct numbers, because you can't get enough sunlight to have all of that vitamin D on board. There are comments about seasonal affective disorder, people that feel depressed, panicky, anxious, irritable, and they'll go down to Florida, get some sun, and they feel great. So are they raising their vitamin D a little bit? Yeah. What are their levels before they go down? Most of those people are below 20 on their vitamin D levels, and of course that can make you feel horrible. So getting a little bit of vitamin D will do that. Of course, you're getting away from your everyday stress, you're on vacation, which might also help, but we have a lot of people that have that anxiety, irritability, depressive, panicky sensation, and when you correct their vitamin D, get it to the 60, 70, 80 range, they feel great. Also, some of those people have low hormones, thyroid, DHEA, testosterone, IGF-1, estrogen, progesterone. So we have to look at the entire picture. But yes, you need the vitamin D.
And then off of that on TikTok as well, this person says that he takes a multivitamin every day, but he's heard, that they're not, he's basically asking, is it worth it to do the multivitamin, or he should be doing separate pills for?
Well, a multivitamin is a great idea, because a good multi that's got, a few dozen things in it will give you exposure to, all the Bs. You're getting a little bit of D, you're getting some calcium, some magnesium, you're getting a little bit of everything. So that's sort of like the hub of a wheel if we're looking at giving you vitamin recommendations. You can't really take everything individually because then you're taking too many pills per day. But if you take a couple of multivitamin capsules and you're doing it breakfast, lunch, dinner, you're going to have better levels, which you can prove on the blood test. It's all about the proof. So beyond the multi, we might recommend extra C, D, CoQ10. So, your blood test tells us where you are. And most of my patients come in taking vitamins. We want the blood test to be done when you're on your vitamins. If you don't take them, then you may be low because you're not taking them. But if you take your vitamins and you come in for our big blood test, that's the best way to do it. And then we can fine tune based on that. So yeah, multi's a great idea.
And then we got an Instagrammer asking about biotin supplements. He said he or she, their hair has been thinning a bit. I've seen a lot of ads for biotin supplements. Do they actually help with hair growth, or is that just marketing? It's
one thing that might help, but you can't look at one thing and expect to get, multiple benefits. So depending upon if it's a man or a woman, doesn't really matter. I mean, you need all sorts of nutrients for your hair, your skin, your nails. So getting good levels of all the B vitamins, of zinc, of beta carotene, of C, of D. I add, collagen peptides, because they're also very good for your hair, skin, and nails, and your joints to an extent. So I wouldn't rely just on biotin. It's probably has the best PR agent, because you hear biotin, biotin, biotin all the time, but it's only one thing out of many that would be helpful. Some people need more protein in their diet. They're not getting enough protein. So that's the thing we look at or find out on the blood test. So your body will tell us. It's just, we have to ask it the right questions. Some people like to use a variety of things to put on their hair, and they talk about the benefits therein. So I've tried it. I think it works. Coconut oil, you can put on your hair, run it through, comb it through your hair, wear like a shower cap or something, go to sleep with a coconut oil in your hair. Some people rave about it. Other people like to put combinations of other oils, argan oil into their scalp with a little dropper. You can get that from, most of the health food stores. So it depends. I mean, for men, sometimes you have to go a little bit beyond that. There's a Capillus baseball cap you can wear where the light therapy can help your scalp. So it varies. Some men need to block dihydrotestosterone from damaging the hair. It just depends upon what we see, based upon testing. Women, as they get older, their hormones decline, and that can affect the hair loss. Thyroid decline correlates commonly with hair loss. So you want to look at all those things and correct each one of them. That's where you get your best result.
And we got one from Rumble saying that they don't eat much fish, but they've heard a lot about omega-3s that are good for brain health. Are there other ways to get enough omega-3s?
Our omega-3s are good for brain health. They're good for thinning your blood a little bit. I think they're a good nutrient, an important nutrient. I spoke about, there was an article here the other day on my very messy desk, by the way. I can't see where I put it, but I was talking about longevity because you're decreasing an inflammatory mechanism. So omega-3 fatty acids decrease inflammatory prostaglandins that can irritate your tissues. So yeah, I think that could be an advantage. The amount you take really should be based upon a blood test. There is a test you can do to look at your fatty acid levels and see what's coming into your body because randomly you have no idea what they look like unless you test them. So they're a good test to do to see what you might need. You don't need tons and tons and tons of fish oil, but a few capsules a day I think makes sense. I tell people to take olive oil every day and take a tablespoon either in the morning when you wake up or you want to take it at night when you go to bed. That can kill bacteria in your stomach. It's good for you. So there are good oils. I think the three best oils. Olive oil, MCT, medium chain triglyceride oil, and fish oil. But fish oil does follow a certain pathway that breaks down the prostaglandins and enhances an anti-inflammatory effect.
All right, we got, changing it up a bit, we got a question on carpal tunnel and cubital tunnel. Could stem cell therapy help me?
Typically, stem helps to repair damage to ligaments, tendons, connective tissue, cartilage. So whenever someone talks about carpal tunnel, I always ask whether or not they've had an MRI at their wrist or MRI at their neck. There are people that have wrist problems that haven't injured themselves but have disc issues in their neck pressing upon the nerve root that can affect what's going on in your wrist or your hands and the tingling. So we want to make sure we have a perfect diagnosis of that. The other way to test on physical exam is to put your hands together as if you're praying, raise your elbows up. If that hurts or creates numbness and tingling, that would also correlate with it. The other way is to put your hands opposite and press your elbows down to see if that occurs. So there are a few different things you would look towards for a diagnosis. So if it is an issue that's occurring at your wrist, then yeah, injecting into the wrist could make a great deal of sense.
Interesting. We got this one. I am due for a fusion in my subtalar joint and looking to explore any other options. I still work out regularly. I just can no longer run or walk long distances. Otherwise, I can manage the pain. Thank you in advance.
Question would be, have you done an MRI to see why there's damage or grinding? It's obviously has to be correlated with damage to ligaments and tendons. People that run a lot, depending upon your weight, are putting a little bit of a pounding effect on the feet every time you run. And people who run on harder surfaces, there's more of that, pounding effect. So the ligaments and tendons inside your ankle and throughout are not the strongest things in the world. They're not the largest ligaments in the world. So frequently you start to see this wear and tear. For those people who have that damage, and we've done PRP injections, we can go in between the bones to get the PRP and certainly the stem cell in there. I think stem would be an ideal mechanism of treatment because you're creating repair. I would just need to see what's wrong with the joint or with the ankles, with the talus, calcaneus, all of the bones in the feet. That's why an MRI is so important. But we've done a lot of that because a lot of people are out there running and doing, pretty strong sports, creating wear and tear and damage on their ankles. I treated a young guy, I guess he was 19 or 20, who great athlete, big kid, 6'5" now, I think. And he used to play ice hockey at Beaver Dam over in, I'm not sure if that's in Locust Valley. I think it is. And big kid skating and came around the goal and then collided with someone else. The other guy was hurt worse, but his foot on the skate went into the boards, got stuck, and he broke his ankle. So he had ligament damage in a few places, tears, and broke the ankle. So ortho set the ankle, put everything in place, made sure it was, in appropriate positioning. And then as the cast came off, we spoke about doing stem. We did stem to inject all around the area, which enhances healing significantly. And he got back to playing. And I think it probably was about 5 or 6 months. I told him, take it nice and slow, do your activities, nothing too hard, too competitive. And he's fine. And I still hear from him, now and then today. And this has got to be 10 years later. And he's doing very well. So ankles are a rough spot.
All right, we're back to vitamins. We got a rumbler saying that I've heard that vitamin K is important for bone health and blood clotting, but I don't know much about it.
Vitamin K2 is important. So there's a lot of commentary on vitamin K2, especially along with vitamin D. Most of the good supplements that have vitamin D in it now will come with vitamin D and K2. It's sort of a double benefit to bones and circulatory picture. If you add on to that nattokinase, which helps to decrease some of the excess stickiness or clotting of the blood, that's a further benefit to the lining of the blood vessels. If we talk about quercetin and vitamin C, and there's a whole host of nutrients that would work together to create these benefits, then you want to put them all together based upon your blood test. But sure, you can test, obviously, for vitamin K2 in your blood. This is what we do.
And they're asking, what foods can you get that from?
There's not much that you can get it from, just like there's not much vitamin C you can get from oranges. It's there, but you're not going to have a boatload of oranges to get enough to get 6,000, 7,000 milligrams of vitamin C a day. So it's not as though foods are going to give you enough of many of these nutrients, just like you're not going to be able to get enough sun to get your vitamin D levels where it should be. So usually taking them will give you your best insurance that they're there. And if you have vegetables and you have other good foods that may have the nutrients in them, that's great, that's fine. But they're not going to give you the big levels that you need in your body.
Okay, moving on. By the way, big Monday. People are ready to go. We love it. We love it.
Absolutely.
Especially because there's no air conditioning in this studio today.
It's a little warm in here.
Little steamy. But we have one. Have you treated anyone with hearing loss, and was it successful?
Yeah, hearing loss, it depends upon the cause. As we all get older, presbycusis is the loss of hearing with age. There are 3 bones inside your ear on the other side of your eardrum, the malleus, incus, and stapes, and they're supposed to articulate to be able to take the vibration from the drum and allow that to get to the nerves in your brain to tell you what the sound is. Over time, when there's damage to the bone, and you could evaluate through an MRI, arthritis can occur on that bone. You can't really take that arthritic bone out or change that mechanism, but there are some people that have hearing loss in a picture beyond those bones, and that could be brain-related. And that recommendation would be stem cell therapy, because the sound hitting your eardrum and the vibration creates the bones to move, and then the signals go from there directly into your brain. So in many cases, as your brain ages, you're losing great blood flow, oxygen, vitamins, minerals flooding into your brain, and that would be improved by stem cell therapy because you're putting new cells to the brain. We have a lot of people that have memory, focus, concentration, brain fog, a variety of issues. And we'll order an MRI of the brain, sometimes a SPECT scan, because that looks for inflammatory issues or maybe vasculitis or the effects of Lyme disease. But the MRI in many cases will show vascular decrease, vascular insufficiency, a decrease in the ability really to get blood flow to all your brain cells. And when you're aging, your brain cells are shrinking and you're making less neurotransmitters. And that affects the entirety of your brain and the entirety of your body. So with any head-related issue, just like it would be for any joint or heart, lung, etc., we want to be able to see if there is decline in circulation or decline in cell numbers or cell counts or shrinkage. So this gives us a far more accurate picture of what we're dealing with.
All right, we got one on weight gain, asking, can stress actually cause weight gain? And if so, what is the mechanism?
Well, stress can cause weight gain because cortisol levels will fluctuate, and that can make you gain weight. DHEA levels, you may be using them faster than you could make them, and that also can make you gain weight. Hormone decline, whether it's thyroid, testosterone, IGF-1, the active component of growth hormone, those can change with stress, and as we age, as they go down, it becomes harder to burn sugars and fats. Without knowing the age of the person, which, would help if you can, message us back and tell us what your age is, or if you're male or female, we can get an idea as to how to comment on or ask you about some of the hormones if you've had the testosterone levels done. We'll be able to give you a little bit more information on that. So the other question, obviously, is exercise and diet. What's a person eating? So everybody that I've seen over many, many years of all ages, when you start to cut back the carbs, you kick up the exercise, and those are two really important things, obviously, because sugars will damage every cell of your body. They can damage your nerves, your blood vessels, your organs. Cut the carbs back, your body has a better ability to burn the fat for primary fuel. You increase the exercise, you have your muscles grabbing and burning, fats. And we'll get into the exercise comments in just a minute. When you correct your thyroid if it's low, and sometimes the thyroid is at the low end of normal, but if the T3 is supposed to be 70 to 180 and you're 71, and you're feeling the effects of low thyroid, changes in your hair, skin, nails, etc., fatigue, issues with weight gain, and we raise that thyroid up a bit to get you into the 30, 40, or 50th percentile, and now you feel better and your TSH comes down, then you're correcting that progressive decline of hormone that has allowed you to gain weight. Same thing with DHEA, testosterone, IGF-1. So there are multiple things to do to burn the weight down. The most effective ones are correcting the cause of the problem. So it's hormone deficiency, that'll make a big difference. If it's no exercise, it makes a big difference. Too much carbohydrate in the diet makes a big difference. So that's why everything's done together. I wouldn't try one thing and just to see what happens. Some people call the office and all they want is to be on the weekly injection for the GLP-1s. And we don't do the injection-only diet. It's all of these things. Great blood test, 20, 25-page blood test, low carb, exercise, correct hormones, vitamins, etc. So it's got to be the combination.
All right, back to TikTok and back to vitamins. I take an iron supplement because I don't eat much red meat, but I've also heard that too much iron can be bad for you. How do I know if I'm getting that right?
Well, blood tests, yeah. So iron is important to be inside your cells because it's the magnet that grabs oxygen across your lung tissue membrane and then delivers it to your body so that iron through NAD can become 36 molecules of ATP. So you need it there. When iron is not within your blood cells, it could act as a free radical. If you damage yourself and you break blood vessels and iron seeps out, you get black and blue, that can be very inflammatory. For people that have injuries where their spine is injured, the big worry is that if blood with the iron in it leaks into the spinal fluid or anywhere around, it's a free radical. It can cause inflammation and damage, and they want to shut that down right away so that the spinal cord or nerves are not damaged from that. So your iron levels are important. I think every woman I've ever seen between teens as they start to have their period, etc., and older will have iron levels that are lower than they need to be because every month they're losing iron when they lose blood. So what we may do is give those individuals one iron capsule a day to keep their levels in a good range. And right before their period, we may recommend 2 or 3 capsules a day a week before to raise it up so when they lose, they're not going all the way down and being totally depleted. Their levels will be here, go up a little bit, you lose some, and you're not dropping down too low. So there are ways to do that. And the blood test looks at iron, iron transport, transferrin, iron storage, ferritin, all these things. So it's a complete picture of iron.
And we got a follow up from the previous weight gain conversation, just asking what are the best foods for reducing inflammation in the body?
Good question. The best way to answer that is to take out the foods that are pro-inflammatory. A lot of people will have foods that have chemicals in them. A lot of people will have regular chicken, which can have arsenic. You know, shrimp can have arsenic. Rice has arsenic in it. Apples, California, you want organic foods. Take away the heavy metals. You want to have foods that don't have GMO or pesticides or chemicals in them, so as much organically as humanly possible. Also, some of the best foods are those with the highest nutrients. Squash has a ton of nutrients and minerals and potassium. That's a great food. And also, besides being a great food all the way around, it's not giving you much carbs. So you could have butternut, spaghetti, acorn squash, zucchini, all of those things are great for you. Yes, having some fish oil as a supplement, having CoQ10, vitamin C, your nutrients, all can have free radical binding ability, so that has anti-inflammatory effect. And you can check C-reactive protein. You could look at all of this. Good sources of protein, of course, make a great deal of sense. Olive oil and the good oils are healthy for your body, avocado. So it's just as much what you take out to decrease inflammation as what you might put in.
We have a question on your thoughts of seed oils from TikTok.
So seed oils have come to the forefront over the past few years, and certainly RFK Jr. has been a champion in this realm. I think you want to have the most simple natural oils in your diet. Olive oil is by far the best, and fish oil. You could have medium chain triglyceride oil. I don't know that I would use any other oil because so many of these things are so manipulated and you don't really know what you're getting. And there are inflammatory circumstances that come with some of these other manipulated oils. So the only thing that I would have would be olive oil, fish oil, and MCT, medium chain triglyceride oil. I wouldn't have any of the other oils. Olive oil, on a note, you know, a lot of olive oil, if you look at labels, you look on the shelves in your local supermarket or the places that you would go to get your regular food, are not pure olive oil. It's got all sorts of other stuff in it. Pure olive oil is somewhat strong. It may have a strong taste, which I think is great. It's not super thick and viscous like some of these combined things. I'm not going to tell you the bad sources of olive oil that may have corn, safflower, whatever else in it, and maybe 10% olive oil. You could read about this online. But there are some very good olive oils that are organic, that are healthy, that are, you know, extra virgin, cold pressed, but it's got to say 100% pure olive oil. Nothing else in it.
We have a question on wondering if avocado oil is acceptable.
Avocado's fine. Just want to make sure it's organic.
You know, it's funny because I remember there was this huge fad where like every big chef were like, oh, you have to use, you know, this seed oil, that seed oil. It's got a higher burning temperature. It's better for steak, this and that. It's like now knowing how toxic
it may very well be that, like everything else that we've been exposed to that has chemicals and stuff in it, there's that selling point. Oh, it's great for this or that, but it's not good for your body. Like the dyes, like weed killers. You know, it'll kill the weed, but it may kill you.
Slowly.
You know, slowly but surely. So I still am amazed that these things are on the shelves in some of the stores, the weed killers, because they're linked with different cancers. But this mechanism has to change. That's why I'm so excited at the prospect of RFK Jr. getting this done, and the other people in the administration, the president, and all the great people he's pulled into the administration to do this. This has never been done before. But imagine if over the course of a few months and a few years, our food is better, safer, healthier. The environment is better, safer, healthier. There's no spraying in the skies with all this garbage that we know is happening. We've seen, you know, videos of this. The world's going to be a much healthier place.
Amen. We have a question on high cortisol levels. My doctor doesn't seem to agree and won't order a blood test, but this person thinks that they have high cortisol levels.
It's easy to see high cortisol on a blood test. You know, any lab can do it. It's not as though labs out there aren't doing it. Doctors typically just don't test for it. So it's a measure of your stress response. If your DHEA is low, either because of aging or getting older or huge amounts of stress because your body's making it and you're using it faster than you could make it, the high cortisol may correlate with high stress. It's not going to control everything in your body. You still have to look at vitamins, minerals, hormones, heavy metals, adrenal function, all the other hormones, thyroid, a full 12-part thyroid panel. You have to look at the entire picture. But that may be a significant component to why your body doesn't feel good.
And then the follow-up was just what are the signs of the high cortisol and what other ways?
Sometimes just either anxiety or difficulty handling stress circumstance or situations. It's not as though it's a light switch that goes on and off where people will say, this happened this day and I tested and my cortisol's high. It's something that evolves over time. Just like the loss of hormone production, it happens over time through a variety of circumstances.
And then we got a question from Reddit just asking, they said that they heard that vitamin E is good for skin and aging. Does taking a supplement actually help, or is it better to get it from food?
It's hard to get vitamins from your food, especially when food is grown in the same soil over and over again. That's always been a conversation. And I have the privilege of looking at vitamin levels on every patient I've ever seen. It could be over 50,000 some odd people in all these years. I have yet to see people that have great nutrient levels. Vitamin E, we certainly see decline with, and D is one of the most common things we see they're deficient. But I think as a insurance, getting your blood done, taking your vitamins based upon that, will be able to give you a great level, retesting to prove that. And then you can get some of those from your diet as well, but you can't get them from your diet without supplementation in enough healthy levels.
So can you explain that whole, basically we just said when you regrow something in the same soil, basically what the nutrients are just not there?
So think of growing vegetables in your garden. If you never put nutrients and you just grow the same stuff in the same dirt, you're depleting the dirt. Think on a massive scale, gigantic, massive scale. Big tomato plants, big eggplant bushes, big everything in farms all over the country, growing and growing and growing. If you don't put the nutrients back in, your soil is depleted and you're not getting the nutrients into the food, and therefore you're not getting them from the food. So that's always been a concern. There are organic farms that will put the nutrients in, which you have to do. And I'm sure most growers that want to sell product are going to put nutrients in the food and probably fertilizers and probably some chemicals to make the food grow big and look great. But if they don't, then you're getting foods that just are depleted.
Crazy. We got one on what is the best ways to metabolic slowdown while dieting? Reddit.
Metabolic slowdown when you diet can occur in some people because some people are not eating at all and your body says, wait a second, you're not eating. What am I supposed to do? I'm going to kind of relax. But you want to have your vitamins on board every day. You want to do exercise because the exercise will deliver oxygen, vitamins, minerals, and hormones to your cells so they get what they need. You have to be very careful because if you're really not eating and not having much, your body's going to get worried about that and say, hey, no protein's coming in, or I'm not getting some of the fats and oils that I need. So the whole idea in a perfect world, test your body first, and then you put together a diet based upon that. Then you could adjust that diet according to result. Some people will take out, if their carb intake is 80 to 100 grams a day, they drop it down to 50 grams and they start to see weight loss. And they feel better, less bloating. Other people need to go lower. They need to go 30 grams or below per day to really see that effect and kick up their exercise significantly more. So everybody's a little bit different with the way that they need to control their diet and their exercise. Let's take a switch over to our exercise picture.
Oh, yeah.
So we can take a look and see our little diagram. and we'll talk about the benefits of exercise, and we'll get right back to your calls.
There we go.
One of the, this is a great picture. You can see on the left side, on the top, executive function, memory, neurogenesis, enhancing your nerve ability and function, neurotrophins, neurotransmitters and things, growth factors, decreasing inflammation, including progenitor cell function, vascular and endothelial benefit for your heart, lining of your blood vessels, decreasing oxidative stress, free radical damage, insulin secretion, looking at burning sugars and fats better with the activity as opposed to trying to have insulin bring down the sugars and the fats. Gluconeogenesis, burning fats and sugars out of the liver, VO2 max going up, a lot of oxygenation through your lungs, glucose uptake, muscle endurance, decrease in sarcopenia, which is wasting of the muscles, increasing hematopoietic stem cells, decreasing osteoporosis risk. So there are many benefits from doing this. Another great article I looked at today, and I was curious as to how much oxygen you're getting into your cells from doing the exercise. From this study, it talks about the amount of oxygen delivered to cells significantly increases, with individual potentially is extracting up to 70 to 80% oxygen from their blood compared to when they're not doing exercise and they're not active at 20 to 40%. So critically important to be able to get lots of oxygen to get to all of your cells and your tissues. Other benefits in the same article, it goes on and on. Improve oxygen uptake, the VO2 max we spoke about. Changing atherosclerotic plaque composition, decreasing the fats that sit and can get to sit on your blood vessel lining. Prevention of complications occurring after a heart attack. Functional improvement, even in patients with some heart failure. Decreased endothelial oxidative stress, stopping free radicals from damaging the lining of your blood vessels. Preventing of age-associated muscle degeneration. Improve muscle endurance, stamina, strength, enhance balance, motor coordination. Improve skin structure, you're delivering oxygen, vitamins, minerals, and hormones through all your blood into your skin. Increase bone strength and formation, decrease osteoporosis. Prevention of Alzheimer's and other neurodegenerative diseases. Improve neurogenesis. Decrease inflammation, restoration of retinal ganglion cells, improving vision, decreasing the risk of anxiety and depression. So there's so much that occurs at every different cell in every different area of your body as a result of doing the exercise. So everybody should do at least a half hour to 45 minutes of activity a day nonstop. Granted, you could work out at home or go to the gym and work out in the gym for 45 minutes. As I typically tell people to do. But if you're doing cardio, indoor, outdoor bike, treadmill, elliptical, any of these things, it really should be between 30 to 45 minutes. That's where you're getting your result. You don't have to go crazy and do 3 hours. That might be a little bit of a drawback because now you're really burning up your vitamins probably too much or too fast. But 30 to 45 minutes a day is good.
I love this question, okay? This would have helped me a few years back, but I have trouble swallowing vitamins. Any advice on another way?
Well, there are ways to get a lot of good vitamins in the gummy form. True. A lot of people can't swallow tablets, which can be big. For some people, we'll tell them to break them down or crush them, put them in applesauce or some sort of food. There are good companies making gummy vitamin D, gummy multivitamins, in very low or no sugar. I mean, there's a good option. Some of them make a vegetarian curcumin, which has the turmeric and ginseng, a variety of combinations that I think are good for you. And some of these things you can get in the good health food stores. Some of you can get in BJ's. Vitamin C. So if you're unable to take the big capsules or the tablets. Capsules you can open up, put in food. Some people do that. Some people will take the curcumin, which is a yellowish orange powder. Be careful because it'll stain your fingers. Open the capsule and put it in your food, and people put that on salad. We have a lot of patients that do that. But you may be able to use the gummies and get your nutrient levels in great range.
We got a Redditor asking, I heard that there's been a correlation between people using Monjaro or Ozempic and cervical cancer. Have you heard anything on?
I haven't seen that yet. There have been comments about potential thyroid side effects. There have been comments on potential muscle issues or wasting, but I don't see the muscle wasting with my patients because I make sure they do exercise. We don't have thousands and thousands of people on this, but I would get them started with low carb, exercise, hormone, vitamin correction, etc. Get them started if we want to use the medication for short term as a potential crutch or a little bit of an add-on. That could be done. But I don't recommend those injectables alone with nothing else. I don't recommend people go on those things for years and years or go to really high doses. We haven't done that because we haven't needed to. So the higher the dose, the more potential side effect. So there are lots of things that are possible. I just didn't see any of that in the literature yet. But I'll look.
All right. We got a question on does exercise improve cognitive function and prevent neurodegenerative diseases?
Yes, to some extent, just as I mentioned a few moments ago. So exercise will flood your cells, including brain cells, with oxygen. Really, really, really important. Oxygen through a pathway that NAD supports and helps to create, makes 36 molecules of ATP, which is energy. So the more oxygen you get in, the better. You're delivering all your vitamins, all the B vitamins, vitamin C, vitamin D, vitamin K, all the minerals to all your tissues, including your brain. So there are added multiple benefits there. You're probably making more neurotransmitters because delivery of the nutrients. So in many aspects, your brain does better with getting great levels of oxygen, vitamins, minerals, and hormones. So the exercise delivers everything. If you ordered something from Amazon, and Amazon has everything known to man, A to Z, that there's no delivery, what happens? You don't get it. If you're taking nutrients and you're not doing that good exercise every day, the delivery is just not there. It may get into your bloodstream. It may sort of stay in your blood, but it's not getting there. And there are a lot of examples of this. If we have men that we have on testosterone replacement and they don't do the exercise, their testosterone levels are high in the blood. Their muscles and their other areas of benefit are not really getting it as well as it could. As soon as they start doing the exercise, they feel the strength, the endurance, the sexual drive and benefit. Everything is amplified because you're delivering it right to the front door. So with nutrients, with hormone correction, a lot is about delivery, getting it to where it needs to go. Now, there are people that have brain fog and cognitive issues because of other things, external exposure, heavy metals, etc. So it's not just exercise and vitamins. We have to understand what's occurring there. And then there gets a point where a person could have cognitive function an issue because their cell numbers have decreased because of age. Then there's a mechanism that answers what do you do when your cell decline occurs. You put new cells in, and that's what stem cell does.
All right. And then we have a rumbler saying, I heard you mention chicken has arsenic in it. How so?
So chicken, shrimp, rice, apples, and California wine have been shown to have arsenic in them. And there are many other foods as well. Those are the most common. They feed chicken arsenicals, and this has been going on for a long time, to kill the germs that chicken can get sick from. So it's like taking an antibiotic, and they give chicken antibiotics, some companies probably still do, to prevent illness that damage the product so that when the product is killed and prepared to get to you, it looks big, fluffy, and great. No one's going to buy something that doesn't look good on the shelves. And this happens with fruits and vegetables and apples and et cetera. And that waxy skin on some of the vegetables may be somewhat dangerous. There's something called apeel, A-P-E-E-L, that we know may be dangerous. So you may be getting exposure to this because of how those animals are treated. And regular chicken may have 65 different chemicals in it. And I think regular steak or beef may have 70 some odd chemicals in it. There's a book written by a doctor named Richard Lewis, a PhD, not the comedian, rest his soul, that outlined all the different chemicals that are put in different foods. You'd be amazed to see what they do, and if heated, this chemical does this and that. So this is a bad thing, but you want to eat organically as much as possible. But that's been a very long-standing issue with those foods. Someone that I spoke to said there's a lot of arsenic in the water that may get into feed in some areas, in some properties, or in some vineyards. But I think they also spray the vineyards with arsenic to kill the germs that the grapes would end up, being damaged from. So you got to look up pesticides and chemicals, look about how these chemical companies are killing us.
It's great. A quick Google search, and it's Bill and Melinda Gates Foundation, founded the $100,000 research grant for appeal to exist. It always tends to come back to...
Well, do the research, people. Learn, read, understand. I saw something where...
They said thank you, by the way, on Rumble.
That individual was describing the need for depopulation. And you could look it up online. Yeah. Watch the videos. I don't have to explain it to you. Just look and watch the videos.
Yeah. There was a proposal given to, in order to bring down the temperature of the world, we'll just send up a rocket with a bunch of, pieces of paper to block the sun from the Earth.
Yeah. Oh, yeah, you want to block the sun. That's a really good idea. Kill more things, kill more animals, kill everything. Kill trees. They don't get the sun. It's just insane. I don't understand why that would ever be a thought. But there are people who have these bizarre ideas. I was watching one thing, and not to get too political, but at some point we'll have some political people here to comment. Someone said, if the threat of water rise in the oceans was so significant and the waters were going to come up 10 feet around the world, no insurance company would ever insure waterfront property for 30 years, because if that happened, all of those properties would be destroyed.
Wow.
It's a very simple idea. Makes sense to me.
Wow.
The guy said half of Florida would be gone and Europe would be gone because 10 feet elevation of water would wipe everything out.
I mean, yeah. I mean, when I was in middle school or high school, they said that, New York City would be underwater in 10 years. We're pretty buoyant right now, I think.
So there's another thing that I saw, and people are entitled to believe what they want. But going back like 50 years, we're going to freeze to death. Oh, there's no more gas. Or no, there's no more this. Oh, it's going to... All these things they've predicted over many years never came true. Look at Al Gore. And he has probably one of the largest, most energy and efficient homes in Virginia, and they were going after him about that.
And a beautiful private jet.
But, yeah, and look at all these people that have all these horrible carbon footprints telling you what you have to do. So, yeah, with the next show we're going to start in a couple of months or weeks will be a political show. But quick. I'm not asking anybody to change their minds. Just read and learn and look. Check it out. And one of these things said, all these things that are supposed to happen in the 60s, 70s, 80s, 90s, etc., never happened, but they raised taxes on us because of those things were going to happen.
Isn't it amazing?
And I'm not even going to talk about U.S. aid. There's no person in their right mind who thinks that that's okay. Giving trillions and trillions of dollars out to these, and I think in many cases, fake things just to get the money back to the politicians.
Oh, yeah.
But we'll end our political rant on that. 888-420-9272. If you'd like to call in to ask a question, you could do so now.
Rumble is loving this conversation.
All right, Rumblers. Truth to Rumblers.
Truth to Rumblers. Let's see what else we got. We have one on any... Geez, lost it. There we go. What are the best ways to heal a damaged gut?
So problems with your gut, because it's one of the most important parts of your whole body. It's the doorway into your whole body. I should probably patent or trademark that. The gut is the doorway into your whole body, which it is. You need to sort of see blood tests to see what you're absorbing and what you're not absorbing. And there are simple ways to do that sort of thing. We could have you eat lots of protein and then check your protein levels the day or two after we do that to see if your protein levels go up. If they do, that's good. We can look at vitamins. And if you're not taking vitamins, give you some vitamins and see if the vitamins come up, water-soluble, fat-soluble vitamins. So we can test that. Of course, we can look for bacteria, viruses, parasites, all of that. We can look at amylase, lipase, pancreatic enzymes, digestive enzymes. For a lot of people, improving gut is taking out bad foods from your diet. And for some people, they're eating junk foods. For some people, they're eating too much of one or not enough of another. And it's hard to put together reasons why people eat certain things, because they taste good, they think they're healthy for them. But one of the things we always do is look at absorptive and digestive ability and figure out how to take things out of your diet, put things back into your diet. I like doing a plan where we're, over the course of a week or a couple of weeks, we'll have people drink tons of water. We'll have them use protein powders, like the one that I mentioned, that I got at BJ's for $20 less for a larger size canister. Did I say that? Or gain an organic protein powder. Use that so you're getting the tiniest amino acids, the best source of protein, plant protein, getting that on board, getting away from some of the other foods that may not be organic, including, proteins or vegetables. I like it when people want to do vegetable juicing, but you have to juice organic vegetables. Do not take regular things and juice it because you're probably increasing your exposure to the things that you don't want. And do some of that. Give your gut a little relaxation. Glutamine's good for your gut. Lots of things are good for your gut. But, treat it like an important part of your body.
And then we back to vitamin. I'm hearing a lot about CoQ10 for energy and heart health. Should this be taken with other vitamins?
CoQ10 is important. We tell everybody to take CoQ10. And the amount you take might vary a little bit depending upon your mechanism or your problems. But CoQ10 is very important for your heart because it's great for the mitochondria and allows good contraction of your heart muscle. Everyone's heard about statin drugs, and statins wipe out CoQ10, and it makes your muscles get crampy and painful and achy in a lot of people. And in many people, it decreases the contraction of your heart because the CoQ10 is wiped out. For people that have issues with their heart, we do an echocardiogram. A cardiac company comes into our office on Saturdays, and we'll do carotid tests looking for plaque in your neck, echocardiograms, abdominal, pelvic, thyroid, sonograms, lower extremity looking for plaque. And we want to look at ejection fraction. If your ejection fraction is decreased, as a patient I saw a week or so ago, I think his is 14 or 15%, where it should be 50 or 60. Then you have to switch that statin medication because that may be pushing out or blocking your own production of CoQ10. Put good CoQ10 on board in decent numbers, but we're also going to do stem cell therapy on him so that the IV stem cells will go to his heart, make brand new heart cells that will allow that contraction to return. We've done that before, and I've seen people go from their 20s up to 50s on their ejection fraction. So very, very important technique to help to repair your heart or any of your organs. So there are studies where people that had Parkinson's were taking up to 2,400 milligrams of CoQ10 a day without side effect or risk. And again, Parkinson's patients do extremely well with stem cells. But I think CoQ10 is critically important. You should have it in your diet every day.
And same person is asking, are there any vitamins where you would have you should avoid having too much of? That would be an issue. Overdoing.
It's very hard to see people taking too much of the vitamins.
Would just pee it out?
Because no one's going to take a whole bottle full of something. B vitamins, vitamin C, they're water soluble. Even people taking vitamin C tablets or capsules, if you start to go above 6,000, 7,000 milligrams, you may have a loose bowel movement. You're not going to go past that because, you're running the bathroom, which some people do. It's an interesting idea. You take enough vitamin C to have a loose bowel movement, then you back it down a little bit, and that's where you stay. It's called taking it to bowel tolerance. Interesting idea because it may help to clean your gut out. It may also help to quadruple your killer cells to fight infection. So some people start to feel they're getting a cold or a flu, they'll take it, then back down.
Some medical terms are just really nice. I enjoy that one.
Yeah, in theory, could you take too much vitamin D? You could, but I've never seen it. People want to take one capsule or one gummy a day. No one's taking 10 or 20. So you really don't see that happen much.
All right, let's see what I missed any.
888-420-9272 if you'd like to call in and ask a question. Let's go over, while we're waiting, to some of the emails to the website. Tina has a question about bladder problems and wonders if it could be correlated with allergy. In many cases, it can. Some people have a little bit of a twitchy bladder. Just like any other tissue of your body that has blood flow in it, blood flow will carry antibodies bound to allergens. And we've seen people have allergies to different foods that react in different parts of their body. So foods can do that. It's much less likely that things you breathe can do that. But some people have a lot of caffeine, and they just have coffee all day long, and it's great, keeps them alert and makes them feel good, but that could also make them have a little twitchy bladder and have to go to the bathroom frequently. Caffeine may also have diuretic effects, so that's part of it. But allergy can affect any part of your body because it's propagated through your blood.
I have another one from TikTok. Hey, doctor, I've been reading about adaptogens like ashwagandha and their effects on stress. Are these just hype, or do they actually work like vitamins for mental health?
They do actually work. There's research on them, so I think it makes a great deal of sense. You could look at a variety of different things. I take a supplement that's got 10 mushrooms in it, and it's got reishi, shiitake, maitake, Coriolis, or turkey tail, a variety of these things. And they're all beneficial for your immune response. And there's huge numbers of studies out of Japan on all the mushrooms. So I think that makes, all the sense in the world. So I think the adaptogens are good. I don't think they're going to change your world and make you 6'4" if you're 5'3". But I think these are good things to add on, because think about what you're eating every day or what you're putting into your body every day. Some things are good and some things are bad. So if you put really good foods in, good organic stuff, like with the protein powder, the plant extract I use, and you put some good nutrients, adaptogens, vitamins, herbs, good foods, good spices. I mean, there are a lot of good things to eat. So I think if you constantly think of putting good things into your body's going to be healthier. Absolutely. Keep out the bad, put in all the good.
Checking. What do we got?
Another email. Pauline, tired all the time, can't lose weight, changes in her hair, skin, her nails, just doesn't feel like getting up to go do anything. Well, that can be from a few things. It could be, of course, related to thyroid, because your T3 and T4 drops, your body loses those specific, parameters or function. Could also be from low testosterone. If you're doing exercise, you don't feel good because your muscles are not invigorated by the thyroid and the testosterone. Could be low IGF-1, the active component of growth hormone, because that also is important for muscle strength, stability, hair, skin, nails. So that's going to be a combination of hormone decline. Typically, we see that a lot because everybody past their 30s into their 40s, 50s, 60s, and 70s has some evidence of this, some more so than others. Some people drop like a rock, and they hit a point where their hormones just drop. 1, 2, or many of them. Other people just gradually keep going down until they get to a point where they say, wow, I don't feel good. So that's easy to fix. Let's go to the next question. David has brain fog. Wants to know why. Well, brain fog can be coming from vitamin deficiency. That's extremely common. Hormone decline, extremely common. Heavy metal exposure, extremely common. Allergies may do that as well. And some people can have underlying infections that correlate with that. Like if you have a sinus infection, your brain's going to be foggy. You won't be able to do much, but that should be a transient brain fog. If it's long-term, then we have to look at all those other areas. And correcting vitamins, minerals, hormones, exercise will help to invigorate your brain. And there's an IV we use to pull heavy metals out, so that would help to get rid of those things. We'll take a few more questions. 888-420-9272 if you'd like to call in to ask a question. Garden City office is 516-794-0404. 516-794-0404. Website, drcalapai.com, drcalapai.com.
So one from TikTok asking the difference between fat soluble and water soluble. What does that actually mean, and how does it affect how I take them?
So fat soluble vitamins, are typically staying in your body longer. And with A, D, E, and K, you typically will maintain better levels once you take the right amount. Water soluble are not stored, so they're kind of in and out. That's why you need to take them every day. But depending upon your activity, you need to take all of your vitamins every day. You may take one vitamin D in the morning. If it's 5,000 units, great. That puts you in the right zone, great. You may need to take the B vitamins breakfast, lunch, dinner. Or C, breakfast, lunch, dinner. Because the others are water soluble. Depending upon your activity, you're going to use them up. A vitamin D shot, which we give to lots of patients because they're not maintaining enough of it, is oil-based, and it goes into the muscle. It'll sit there, and it may last for 3 or 4 weeks. So each vitamin has its own, longevity based upon your body ability, to use it up. So your water-soluble vitamins, like people say that, vitamin C, it's important because it does a lot of things for your body. It helps to quadruple your killer cells, binds to free radicals. Some people say, taking vitamin C doesn't do anything, it just makes expensive urine. That's ridiculous because 4 million studies that we spoke about earlier in the show will say different. And vitamin C does a variety of things. If you look up intravenous vitamin C, where we use upwards of 25,000 milligrams, helps to inhibit and kill virus, COVID, shingles, Epstein-Barr virus, helps to attack cancer because the vitamin C has that anti-inflammatory, anti-cancer effect. But you could look at Google Scholar and see a million, some odd 100,000 studies on intravenous vitamin C therapy. So the literature is there. It's just people have this weird idea about, no vitamins. They don't want to take vitamins. When they say that, they just don't know what they're talking about.
All right. Last call, guys. 888-420-9272.
We covered a lot of ground.
We did.
I think.
We did. People are excited for...
as usual.
Yes. You teased them into this whole new realm of...
I like the idea of provoking thought in people, making them want to go look at literature and research and understanding and having that thirst, for knowledge. I think it's a way that people can make themselves really healthy if they do that. But I've always done that. When I first got into practice and the internet first started to exist, which I don't remember what year that was. I know I was in my East Meadow office, maybe in the 90s, and we had this horrible little green screen computer with a really long monitor, and you had to dial up through the phone connection.
Dial up.
That was so annoying. Oh, my God. But I would get on that thing every day, and there was one place to look for nutrition research, Health Database Plus. I don't even know if it's still around. But back then, you'd see some articles. Vitamin C does this, and vitamin K does that, and vitamin D. So at least we had a little bit of an inkling back then. And then very quickly, now you can get information from everywhere in the world in split seconds. I'm not even talking about AI. One of PA students that work with me, which I'll be speaking to this week because I want to hire her, was showing me how AI can give you information in the touch, of a keyboard key. So I asked her to show me and give me a 2-minute discussion of vitamin D and how it decreases cancer risk, with medical documentation and research-based. She typed it, clicked it, done. And as I read it, and I was astonished to see vitamin D, also known as the sunshine vitamin, decreases the risk of breast cancer. The Mayo Clinic did a study here, blah, 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 blah. And this one, Tufts University, was unbelievable. So now you can get this information at their fingertips. So on one hand, looking online for info is important. It's good. Just have to know where to look. That's why I say go to Google Scholar. If you go to regular Google, you'll have people commenting on there that are not doctors, not researchers, and you may not get good information. You may get stuff that may be more tabloid. So you have to be a little bit careful with that. But I think AI, if used correctly, can be a terrific advantage for people to learn about everything. And the beauty therein is that when other people or other doctors say, oh, there's no research on vitamins or no research on STEM or no research on, they have to be very careful what they say, because that person is going to get on their phone or get on their computer or their iPad or whatever and look at research. Everybody's getting on to look at research now. So I love the fact that people are looking for this information. I love the fact that my patients are bringing in articles to me and bringing in studies to me and say, hey, look what I found. Look at this, look at that. I love that. So, we want people to be as educated as humanly possible. All right. Awesome things happening.
Always.
Good stuff. Thank you for listening to the program today. Of course, if you can, send this info to your friends, your family, like, share, subscribe. We'd love to hear from you. Thank you for your emails. Thank you, Reddit, YouTube, TikTok, Amazon,
Rumble,
Pandora, Reddit, Spotify, Rumble, everyone for listening and commenting. We'll be back here on Friday, 12:30. Then again, Saturday at 2:30. Look forward to chatting with you. God bless you all.